Good afternoon, everyone. Howard Gearhauser here with my dad, Dr. G. In today's video, we're adding to another episode within our coronavirus playlist. This is what we keep getting questions about, so we'll keep making videos on it, I guess. As long as this topic keeps trending and is at the forefront of our minds, we're here to serve you guys. So one of the questions we're getting is, why are people that have had heart conditions or heart disease more exposed to the coronavirus? There's some new statistics coming out of Italy that 76% of the Italians who are dying or having severe cases of the coronavirus have had heart complications or heart disease. What's going on here, Dad?
Well, I haven't looked at that in detail. I'm not touting myself as an expert on this because I haven't even looked at the research behind this or anything. But one thing about people with heart disease is many times they have underlying hypertension or high blood pressure. And high blood pressure has been known to increase the expression of the angiotensin converting enzyme 2. So we call that ACE2. So ACE2 seems to be a portal to allow the virus to enter the cell, and that's what makes you sick. So if the virus stays in the bloodstream outside the cell, and that's what it tends to do in kids, is the virus gets into the blood so that the kid can pass it on to grandma, but the kid doesn't get sick because the virus is not entering the cell. Because when it enters the cell, then it hijacks the cell's machinery, and that causes the cell not to be able to do what it's supposed to do. In the case of cells in our alveoli, in our lungs, creates adult respiratory distress syndrome, ARDS, and that syndrome is like, if you get ARDS and you're in the ICU, something like a 45% mortality risk when you get to that stage. So this angiotensin converting enzyme 2, which is upregulated in high blood pressure, and that allows the cell, or that allows the virus to enter the cell to create more serious disease. So a lot of times with heart disease, an underlying condition is high blood pressure, and sometimes heart disease will lead to high blood pressure because your body responds with high blood pressure to get adequate flow to the organs involved, whether it's the heart or the brain or the kidney. And if our vessels narrow from a process called atherosclerosis, and that's where we get inflammation inside the artery, and they build up a plaque, and that narrows the lumen or the space inside the hose to let the fluid through like a garden hose. Then to get the same amount of blood past a narrower opening, you need to increase the pressure. So that's what the body does automatically. And blood pressure goes up as we age. The death risk in the COVID-19 goes up with age, and heart disease risk goes up with age. And of course, there's that correlation between heart disease. If you have it, you're much more likely to get a serious case and wind up in the hospital or the ICU if you have underlying heart disease.
So it's more of a blood pressure issue than...
Well, we don't know.
We don't know.
But we know the blood pressure, there's a mechanism to why blood pressure is going to make you more prone to worse disease with this virus.
So if it is blood pressure, which, like you said, there's no certainty there necessarily, what are some things people can do to naturally regulate their blood pressure?
Okay, one way is to reduce stress. Stress and fear, and the stress hormones, they upregulate the flight or flight nervous system, which is the sympathetic nervous system that constricts the arteries. So when we constrict the arteries, then we get higher blood pressure. So stress can do it. The other thing that can do it is lack of sunlight. We talked before about sunlight on the skin. The ultraviolet light actually releases nitric oxide, which lowers blood pressure. So nitric oxide inside the endothelium of our artery, nitric oxide is released and it relaxes the smooth muscle in the wall of the artery, so the artery opens up. So sunlight will lower your blood pressure. Plus it sets your circadian rhythm. Plus it gives you vitamin D, which is helpful for your immunity. So we're telling our clients, at this time, especially as the sun intensity is increasing, get outside more as a protective factor.
So there's getting outside, then there's also grounding. I know you've mentioned grounding as it relates to blood pressure. Is that accurate?
I believe there's been some small studies that show that blood pressure goes down a little bit when you're grounded versus ungrounded. Trouble is, most of us don't go around with our shoes off. I think that would be a good thing if we did, but unfortunately, the reality in America is I can't even get my own family members to go barefoot. So good luck.
All right. Well, I think that concludes today's video. Just a, kind of interesting thing how the heart disease and the COVID-19 are correlated, but, that's also an age thing. So the older you get, the increased chance you have of getting a severe case of it. So kind of interesting. It was a question we got, so we thought we'd answer it. We'll see you guys on the next video.